first of all, I passed out your guys' health assessment final checkoff list. So there is a specific day, Tuesday, December 2nd, Wednesday, December 3rd, and then Thursday, December 4th, which I went through and asked you guys what worked better for your schedule. And then there's 6 of you scheduled for each day and time, because there will be me, Carolyn, and Siobhan that will check you guys off. So there's 6 of you on that, and there's somebody across from you, but that doesn't mean that that's your partner. So when you come in, so if you're scheduled on Tuesday, December 2nd at 8 o'clock, those 6 people will show up at that time. Nobody else has to show up at that time. Those 6 people will then draw an A, B, or C on which instructor will check you off. And then you will also draw a partner's name. So I'll have everybody's name in a hat, and you'll pull that person's name out, and that's who you'll check off. And then one of you guys will draw an A, B, or C, and that's who will check you off. Does that make sense?
Yeah.
Any questions on that? Okay. And then this is your guys' final checkoff grading criteria. And there's actually 3 pages to it, okay? And it's very, very specific on where your points are at. And it's categorized in different areas. So like the first one, it says washing hands, introducing self to patient, obtaining a brief history, and asking patient if they need to empty their bladder before you start the exam.
What do you mean by the history? Like how in depth do you want us to go with that?
Like allergies, if they're allergic to any medications, if they're taking any medications, or if they have any medical diagnoses that would be concerning for you. So
Okay.
if they have an injury and you're going to be manipulating their joints and stuff, that would be something important for you to know. Or if they have abdominal pain for something that's going on, if you're going to be poking on their stomach, then obviously that would be a concern.
So as long as we do something, we'll get the points for that one.
Right,
Okay.
right. As long as you address it and ask those questions.
Okay.
Are you allergic to any medications? Are you taking any medications? Or is there any medical concerns or diagnoses that I should be aware of today as I do your physical?
Okay, sounds good.
Okay.
In the past, we haven't been docked if we go out of order. Do we have to go in that order because there's so many?
No, I mean we're not grading you on making sure that you go in order. We're grading you on that you get everything completed. It's gonna be easiest for you to remember if you go head to toe.
Right.
So, and that's how we would want you to assess your patient, is head to toe anyway. So that's what you should be focusing on, is head to toe assessment.
But if we forget something
And then go back, you can go back.
okay,
Yeah.
then won't we docked
No.
because we're not prompt?
No. As long as you're not prompt, or as long as you get to the end and say, did I forget anything? That's when you're gonna, you asking or you being addressed that you forgot something is you being prompt the first time. And then the second prompt was if you needed more specific on area that you forgot or something. Does that make sense?
Yeah.
Okay. And the other thing that we want you to do, you're gonna knock, you're gonna walk in, you're gonna wash your hands, use the alcohol. The other thing is make sure that you ID your patient. I know that we don't have bracelets on, and sometimes we have to pretend in the lab, but you're never gonna walk into a patient's room and not look at their bracelet to make sure that you have the right patient. Okay, so make sure that you identify your patient also. Okay, and that part of obtaining history could be asking them, their date of birth, because then you're also checking, are they alert oriented, things like that. Okay, and then you will go ahead and you're going to all have to share the scale. Okay, because you're going to check your height and your weight on your patient. Okay, you're going to do all the vital signs. We don't have pulse oximeter on here. We don't have those in the lab anyway. But you're going to do height, weight, temperature, blood pressure, pulse. Okay, you're going to check their capillary refills. Make sure that you do that. And then you're going to do skin assessment, hairs and nails. That's going to also tell you, the color to make sure that they have good circulation. Part of the skin assessment that you always want to remember too with your hospital patients is you guys could be the first ones that identify them for any skin breakdown. So if they have any bruises or if they have any sores, you always want to make sure that you check their heels, make sure that they don't have boggy heels or concerns where there might be a breakdown, or if they're broke something or they're going to be laying in bed for a long period of time, where are their heels going to be resting? They're going to be resting on those sheets, and sometimes those sheets are the shear of those sheets can cause, so that you might have to prop them up. So just be aware of that. And then make sure that you do check orientation of person, place, and time. Okay, you don't have to state, I'm checking person, place, or time, but if you're asking those questions, then we know that you're checking that. Does that make sense? Okay. And then it moves down head and face because it's going in order, okay? You're going to check scalp, hair, the cranium, and then like the facial nerves or all of your nerves are in order with head, face, and neck. So like, don't be overwhelmed thinking, oh, how am I going to remember all of those nerves? If you practice and train your brain to go in order like that, there's a nerve like with each section and sometimes a couple nerves with a section. So you're going to catch those nerves. Does that make sense? So don't stress or overwhelm yourself with it. And then it goes down to eyes. So with your eyes, you're not going to do an extensive exam like you will today with your checkoff. You'll do the peripheral vision. You're going to do the corneal light reflex, your positions of gaze, your cover, uncover, your accommodation, and then the external eye structure. So make sure that you're looking at it. You're going to look at the ears, and you're going to look at the external ear. You're going to do the whisper test, and then you will do an otoscope exam. That you're looking that their tympanic membrane is pearly gray. Okay. Verbalize those things. The more you guys verbalize to us, the more we know that you know what you're doing and that you're getting everything accomplished. Okay. And then the nose exam, mouth and throat. You're just working your way down, and then you're going to go to the neck. Make sure that you check the lymph nodes and make sure that you identify those. Range of motion, you're also checking the range of motion and the strength in these areas also as you're going head to toe, okay? Upper body, you're gonna palpate things, you're gonna percuss things, you're gonna auscultate things, and you're gonna check the strength of it also for each area. This really does display for you what we want you to focus in on. I know that when we did each section as your checkoff, it was more detailed. This isn't as detailed, but it hits the highlights of everything that is important that we want you guys to know and understand, okay? And there's 1 point for each section, and then there is a couple things that is worth 2 points. Like when you get to the heart, when you auscultate the heart sounds with the diaphragm, that's 2 points, and then you auscultate the heart sounds with the bell. We want you to do both, okay? Make sure that you do all of it, the bell and the diaphragm, okay? And start with the bell, listen to it, go to the diaphragm, listen to it, okay? I wouldn't go, aortic, bell, diaphragm, and then, keep switching it back and forth. I would do all of one and then all of the other, okay? Abdomen is next, so you're going to listen, you're going to inspect, you're going to auscultate, and then percuss. Remember that you have to inspect, auscultate, and then percuss the abdomen because you don't want to be moving things around, okay? Light palpation, deep palpation, you're going to palpate for the liver and the aorta, and then you need to verbalize where you find the femoral artery, just like, or the femoral pulse, just like you did on the other, okay? Lower extremities, you're going to inspect and palpate them. Make sure that you palpate all of your pulses and that you identify the pulses when you do palpate them. You should know the verbiage. You should be able to identify all of your pulses, okay? The neurological system, you're going to go through just like we did for the neuro one, and you're going to do all those little tests. Erica, did you have a question?
No.
Okay. So you're going to do sharp and dull, light touch, and vibrations on the arms and legs, and it does identify arms and legs. Okay. You're going to do your sense of position. Make sure you don't forget heel to shin. A lot of you guys forgot heel to shin, so make sure that you don't forget that. You are going to check all of your deep tendon reflexes, and there's a point for each one of them that you do check. And then you'll get to the neuromuscular, and you will have them walk, just regular checking their gait, make sure that they're steady. The heel to toe, tiptoe, and then walk on the heels. You're going to have them do the shallow knee bend, the Romberg test. You're also going to have them, you're going to assess for scoliosis, and then range of motion of the spine. Okay, so make sure that you don't forget that. Range of motion of the spine isn't just having them bend over and check for scoliosis. You have to have them do all the little things for range of motion. And then for self-care teaching, we're going to have you guys, if you have a female, obviously you're going to do breast self-exam, and if you have a male, since we do have one male in the class, then you will discuss testicular self-exam. And you're discussing it with them, not demonstrating on them. We do have the models that you can use with them, and you're going to ask them, do you perform it? How often do you perform it? Do you know what you're looking for? You're teaching the patient, but you also want to know what does the patient know or what does the patient understand. You need to follow up with that part. And then you need to review the findings with the patient. Allow them to ask questions if they have questions. And then you also will be graded on professionalism as you. So So how are you dressed? Are you dressed as if you were going to clinical? Is your hair pulled back? Do you have your stethoscope? Do you have your pen light? Are you professional when you talk to your patient? Okay, those are all things that are important that you should be doing at clinical, and we want this to be the same scenario for you as clinical. No hoodies. You can wear a long sleeve shirt underneath your scrubs if you need to, but make sure you have all of your equipment, come prepared, and be professional, okay? Any extra piercings need to be taken out just like you would for clinicals, okay? And then provide instructions and explanation to your patient during exam. There's a point for that. There's also a point, a specific point if you do ask your patient if they need to void before you start, because you're going to be palpating and things. And then there's also a point for you to pull out the leg rest on the bed, because how uncomfortable is it for your patient that, you know, that's not pulled out when you're examining them and they have to lay down. And then, like I told you guys before, you can all have a note card with notes on it, you know, to help you, but there is points for that. So the minimal use of a note card. And what I've seen in the past, the semesters that I've taught this, is that nobody uses their note card until they end, and some of them don't even use it at the end, but they go through the whole entire head-to-toe assessment, and then they're like, well, can I look at my note card just to make sure I didn't forget anything? And that's what they do, and they didn't forget anything, and then they're done. So I think that if you guys practice and you guys get into that routine of being able to do a head-to-toe assessment like that, you're not going to need that note card either. If you're going to that note card all the time and having to check, okay, did I get everything in that system, or did I get everything in that system, then to me, I feel like you're not prepared, or that you did not practice that much, that you're not prepared, that you don't have the confidence that you can come in and do this. Okay? Questions on that?
So if we have a note card and we do just check it at the very end, is that a doc?
No, because that's minimal use.
Okay.
If you had to check it with every system, then to me that is too much use. Minimal use would be using it at the end.
Okay.
Yeah.
How many points is this one?
It is a total of 100 points. 100 points. And then don't forget, a week later, you guys have your written documentation.
Yeah,
And
what's-
that's all on Blackboard.
Oh,
And
okay.
pretty much what it is, so this is on Blackboard for you guys to study with too, and review. And that's how you should practice. Like I said, over Thanksgiving break, do it on all of your family members. But, so a week later, what you did, and I would recommend, if it was me as the student, I would recommend to do it right away, that documentation, because what you're doing is everything that you just did on your partner or your patient in the room, now you're gonna write it all down.
Yeah.
So if you go and do it right away, I mean, usually you're here the whole half of the morning, you know? So if you're done at 10 o'clock with yours, why not spend that other 2 hours that you'd be here anyway and just document it and be done with it, you know? Give yourself peace of mind, and then you guys can focus on your other finals the other week, and that part is done. Because it's just, don't procrastinate that part. I think that you'll really kick yourself if you do that.
It's like vital signs and height and weight and stuff.
Yeah.
We write that
You
stuff
can write
down.
that stuff down, yeah, so that you can use it later. And actually, I write it down as I'm doing your checkoffs, so you're gonna verbalize that to me. I write that down, so, because
Okay.
we give you 45 minutes to do your head-to-toe assessment on your patient, I write that down on your grade sheet, so you can get that from me afterwards. Okay, and Carolyn and
We'll get
Siobhan.
that back.
No, you won't get this back.
Oh,
I'll
okay.
put this in your file,
Okay.
but you can get the vital signs off of it. Yeah. And you'll know at the end of that, you know, what your score is on
Okay.
this portion of it. And then the other written portion. All great. So as soon as you're done with that written portion, obviously if you submit that right away, then I'll grade them as they come in. And then you'll know what your final grade is.
So is it just like a fill-in thing, like on Blackboard?
Uh-huh,
or-
yep.
oh, okay.
Yep,
Is it
it's
like
papers
soap
and it has the different, no, it's not a soap, no. It has these different categories and you're gonna document your findings.
So you want us to,
like at the hospital documenting on.
Right, but it's written.
So we can submit it online, we don't have to print it off and bring it, or?
Right, there's a Dropbox on Blackboard,
okay.
cause you'll type it, so that it's very legible. It's an outline, and that way it'll be legible and easy to read, and you just document your findings and you submit that, and then you're done.
So like, do we take notes while we're doing it, or is it easy to remember everything?
Yeah, you'll remember it.
Okay.
Don't take notes, because like I said, 45 minutes for you to complete
That's
the
true.
exam. And if you're taking notes or writing all that stuff down, then that's gonna take time away from you. But if you come out and do it, Lydia, as soon as you're done, you're gonna remember it. Because
Okay.
you're gonna look at this stuff, and and you're gonna remember head to toe, and you're gonna remember your findings. That's why I think it's easier if you just come down and write it.
So we
You
can
guys
just-
could always go to the other side of the
So we
lab.
could just print a blank one off and like kind of match it and like so
In
that we
here?
know. Yeah.
Or bring your computer that day, and as soon as you're done, just sit at your computer and start typing it.
Okay. Sounds good.
Do people get pretty close to the time limit?
You guys will not believe, it will not, one, feel like 45 minutes that you've been in there, and two, you will not believe that, oh my gosh, I just did all of that, and I did head to toe, and I didn't forget anything.
Would it be better if like we got close to the time limit to like finish and like go over, or like should we just stop at the 45? Like what's
I want you to not pay attention to the time. I want you to focus on your patient, and I want you to do head to toe on your patient, and not think about, oh my gosh, I have to stress about getting done in 45 minutes. That's not the focus of this. The focus is that you know how to assess your patient head to toe and that you complete your assessment. So don't stress about the time, because that's not something that we're gonna focus on. I mean, if you're dilly-dallying and you're really not knowing what you're doing and you're really having to, focus or think about each system and did I forget anything in that system, then we already know that you're not prepared and that you're not gonna do well on it, okay? But I think that you guys will, think about where you came from in August on how you had no idea what to even think about looking at somebody's head. Yeah, you had no idea what to even think about. Yes, and now look at you. You guys can come in and you're just whipping it out and you have more confidence when you guys are doing your checkoffs. I really think that your confidence is even gonna boost when you guys get done with your final checkoff, because you're gonna be like so impressed with yourself, like, how did I just memorize 3 pages of what to do on somebody? And that it'll be the same thing when you guys are doing clinicals at the hospital. Every time you assess a patient, it's gonna be more natural for you to do it. You're not even gonna have to think, oh, did I listen to their lungs? Oh, did I listen to their heart? You're not gonna have to think about it. It's gonna just come natural for you. Remember how I said at the beginning, if you forget something, it's okay. Just go back in and say, oh, I forgot to check your pulses and your feet. I'm gonna check those real quick. And it's not that big a deal. The patient's not gonna be offended that you forgot something, you have to come back in. They love to see you in that room, so anytime you come in, that just gives them another chance to see you. Taylor?
At some point, like maybe next week, could we just see you do like a bedside assessment? Because I know we're like getting used to it with our data tables, but and we talked about it, but my preceptor, when we go to joints, she never is in there when we do it. We just go do it, and I just think it'd be helpful.
Yeah, when we
to,
start
see
next week,
it.
before we do the simulation and stuff, I can take somebody in there, that room's big enough. I can take somebody in there and I can just show you guys a head-to-toe assessment, just like it would be at the hospital. What they're expected for you to document at the hospital, I can just start, with that.
You really,
Questions?